Adult Appendicitis Score. Good day. Today I'm going to talk about the Adult Appendicitis Score and its role in acute appendicitis. I'm going to cover what the Adult Appendicitis Score is, who uses the Adult Appendicitis Score, the function of the Adult Appendicitis Score, the new considerations that come with the Adult Appendicitis Score. The Adult Appendicitis Score will be compared to the Alvarado Score, how the Adult Appendicitis Score risk stratifies patients, and the advantages of using the Adult Appendicitis Score. The Adult Appendicitis Score is a scoring system or a clinical decision rule that is used when acute appendicitis is suspected. Other scoring systems include the Alvarado Score, Appendicitis Inflammatory Response Score, Score, and the Pediatric Appendicitis Score. In terms of diagnostic accuracy, the Adult Appendicitis Score is superior to both the Alvarado Score and the Appendicitis Inflammatory Response Score. The Adult Appendicitis Score is used by general medical practitioners, specialists, and other trained medical personnel in the emergency room. Like other scoring systems, the Adult Appendicitis Score risk stratifies patients into low risk, intermediate risk, and high risk patients. Using clinical scoring systems reduces unnecessary hospital admissions, allows for selective and judicious use of imaging modalities, and also reduces the negative appendectomy rate. Once a clinical score has been given to a patient, then a decision can be made as to whether the patient can be treated as an outpatient, or whether the patient needs to be admitted for further imaging tests, or whether the patient needs urgent surgery. The Adult Appendicitis Score takes into consideration two factors, which are the length of time passed since the onset of symptoms and also the diagnostic difficulties in the childbearing female. Let us compare the Adult Appendicitis Score criteria with that of the Alvarado Score. Starting with symptoms, the Adult Appendicitis Score has only two symptoms: right lower quadrant pain, which scores 2 points, and migratory pain, which also scores 2 points. The Alvarado Score has three symptoms, which are anorexia, migratory right iliac fossa pain, and nausea or vomiting. Next, we look at the signs. The Adult Appendicitis Score has only got two signs, which are right lower quadrant tenderness and guarding. Right lower quadrant tenderness for all patients 50 years and older scores 3 points and 1 point in women between the ages of 16 and 49 years. Mild guarding scores 2 points and moderate to severe guarding scores 4 points. Fever has been omitted in the Adult Appendicitis Score. The Alvarado Score has three signs, which are right iliac fossa tenderness, scoring 2 points, right iliac fossa rebound tenderness, scoring 1 point, and a lower grade fever, scoring 1 point. Next, we look at the blood work and the biochemical tests. In the Adult Appendicitis Score, the leukocyte count is divided into three ranges. A leukocyte count between 7.2 and 10.8 scores 1 point. A leukocyte count between 10.9 and 13.9 scores 2 points. And a leukocyte count of 14 and greater scores 3 points. In the Alvarado Score, a leukocyte count greater than 10 scores 2 points. The predominance of neutrophils in the peripheral smear is divided into three ranges in the Adult Appendicitis Score. 62 to 74% scores 2 points, 75 to 82% scores 3 points, 83% and greater scores 4 points. In the Alvarado Score, a left shift of 75 or more neutrophils scores 1 point. In the Adult Appendicitis Score, the C-reactive protein scoring depends on whether it was measured within 24 hours after onset of symptoms or after 24 hours. If the CRP was measured within 24 hours after the onset of symptoms, then a value of 4 to 10 scores 2 points, a value of 11 to 24 scores 3 points, a value of 25 to 82 scores 5 points, and a value of 83 and greater scores 1 point. If the CRP was measured after 24 hours after the onset of symptoms, then a value of 12 to 52 scores 2 points, a value of 53 to 151 scores 2 points, a value of 152 or more scores 1 point. The Alvarado Score has no CRP criteria. Patient risk stratification. Like other scoring systems, the Adult Appendicitis Score groups patients into low risk, intermediate risk, and high risk. 0 to 10 is low risk. 11 to 15 is intermediate risk. 16 and more is high risk. Low risk patients may be treated as outpatients. Intermediate risk patients must be admitted for repeat examinations and imaging tests. High risk patients need urgent surgery without prior imaging tests done, because imaging tests can cause time delays in high risk patients. These are some of the advantages of using the Adult Appendicitis Score. Having a more structured approach in the diagnostic workup of acute appendicitis, a reduction in unnecessary hospitalizations, a reduction in the overuse of imaging tests, a reduction in the underuse of imaging tests, and a reduction in the negative appendectomy rate. That concludes our talk for today. Please let the people like, let the people share, and let the people subscribe to Dr. Siko's Room for more videos. I thank you.